Hi, my name's Sophie Albanez.
My name is Megan Tervo.
And I'm Bridget Boscolo, and today we will be presenting about climate change and cardiovascular diseases in the 21st century.
So, cardiovascular diseases, or CVDs, are defined by the World Health Organization as a group of disorders of the heart and blood vessels. They're the number one cause of death globally, and a couple of examples of different CVDs include coronary heart disease and rheumatic heart disease.
Some climate factors that contribute to causing CVDs are heat exposure, air pollution, the spread of vector-borne illnesses, and increased ocean salinity and eco-anxiety due to increasing extreme weather events. This figure from Jacobson et al. Shows how those different factors can lead to different things like myocardial infarction, strokes, heart failure, and a long list of other things that will be affecting heart disease. All of these different factors cause direct triggers, but some of them also have indirect things like the vector-borne illnesses, which can lead to Lyme's disease and malaria, which will then put more strain on your heart. So the stress factors can be either direct or indirect.
Moving on to studies on climate change and CVDs in the 21st century. The first source called Climate Change and Cardiovascular Disease. The authors examined how rising temperatures lead to higher rates of heart attack, stroke, and heart failure. Climate change and climate-related stressors are directly affecting cardiovascular disease and raising the chances of death, which you can see in the graph here as it shows in the summer months. There is a big peak in deaths due to CVD. This next source is going to talk about extreme weather events and acute cardiovascular events, which shows that not only the heat damages or causes cardiovascular events, but also the cold. So while heat leads to things like dehydration and electrolyte imbalance, the cold leads to increased blood pressure and vascular resistance. Both can lead to higher hospital admissions for heart failure, heart attack, stroke, and arrhythmia. And this shows that extreme weather not only increases the risk of cardiovascular events, but it can also be a direct trigger.
So we're going to look at climate change and cardiovascular health through the Atkins study. It shows that extreme weather events often that cause power outages can also lead to a rise in hospitalizations for cardiovascular diseases. 11% of deaths caused by heart disease in post-hurricane mortality data. So after hurricanes, 11% of the deaths due to hurricanes, all the things that happen during hurricanes, 11% of those deaths are from heart disease and issues with lack of access to medications or other things that can happen when there are hurricanes. Um, After Hurricane Sandy, there was a 22% increase in incidence for mortality and incidence of myocardial infarction, and that is compared to the data from 5 prior years.
So, the next few studies make predictions on how the correlation between cardiovascular diseases and climate change will look in the future based on different approaches. So, the first one analyzes heat-related mortality in Finland through an observational study across 6 major Finnish cities, where they established a correlation between summertime heat and mortality through different analytical approaches, where they saw that higher heat indexes resulted in statistically significant higher rates of cardiovascular death across demographics. And then an analysis of 2 different pathways, they saw that the summertime mortality burden is almost 2 times greater if climate change is driven by fossil fuel development compared with the sustainable development pathway. So the next study then does a statistical analysis and prediction of these different pathways. So they saw that extreme heat resulted in over 1,000 excess cardiovascular deaths per year from 2008 to 2019. And then they made 2 projected scenarios, one with middle of the road socioeconomics and moderate emissions. So very similar to kind of just if we keep going, how we're going, and then a pathway based on fossil fuel development and significant emissions increase. Both these pathways saw increases in excess cardiovascular deaths. The first one, a 162% increase, and the second one, a 223% increase, indicating that no matter what, if we do not change to more sustainable pathways regarding climate change, we will not only see all the other impacts of climate change, but we will also see dramatic increases in cardiovascular deaths as a result. This next figure sort of exemplifies that, showing on the graph on the all the way on the right, that you can see that there's significantly more excess cardiovascular deaths per 1 million adult residents in the United States versus the current period or the mid-century, the first pathway. So if anyone has any questions regarding this topic, please feel free to reach out, and our references are listed on the next slide.